Respected chairpersons, at the outset, I'd like to thank OPI for giving me this opportunity to be in this forum today. So I've been asked to speak about the seven commandments of oculofacial aesthetics. I just want to highlight the 7th number commandment of the 10 commandments that we have, and the 7th commandment is the commandment of love. So it's better to listen than to speak. So no financial interest. We all know that the most important requirement of any aesthetic procedure is that a very clear understanding of the muscle. One should have a good knowledge of how the muscles are working, and there are different groups of muscle: the muscle of the upper part of the face, the muscle of the lower mid part of the face, and the muscle of the lower part of the face. Most important, when you look to these orbicularies, the procerus and the depressor, supercilii and the corrugator, these are all depressors. So the only elevator in the upper part of the face is the frontalis, and the rest are all the depressors. Then the most important aspect that we all should know that these are all paired group of muscles. So a very clear understanding about the thickness of the muscle, because this all muscle starts from the bone and inserts into the skin. So whenever we do any procedure, we should know where they insert and where they originate. And the next is the muscle of the mid-face, Very important muscle is the levator labii superioris aeruginosa, which originates from the nasal bone and inserts in the area of the nose and to the lip. We have the levator labii superioris and the zygomaticus. This is actually one group of muscle arising from two parts of the zygomaticus bone. So we divide it into a major and a minor. So this muscle of the mid-face are basically the muscles of the smile, which elevates the face, which elevates the lips. Then we have this risorius muscle, which is a very important muscle, which is a muscle for frowning, muscle for the smile too. Along with it, we have the orbicularis oris muscle, and which is the most important muscle of the lip. But the muscle of the lower part of the face is basically the saddening face which it produces. These are the depressor anguli oris, the depressor labii inferioris, and the depressor and the mentalis. Next important requirement is that one should know the anatomy. One should have why I'm telling this muscle of the facial expression are very important. If you look to this animation here, you can see whenever we talk, whenever we speak, or whatever expression we do, the muscle of the upper part of the face, the muscle of the mid part of the face, and the muscle of the lower part of the face, they are all interrelated. So it is very important that when we do any aesthetic procedure, we do it as a facial procedure. It is not that we are doing an isolated component of the face. And the next very important requirement is the anatomy, because it is this anatomy which helps us where are the main communication between the internal and external carotid artery. If you look to the system here, the blood supply here, we all know that we have a common carotid, and from the common carotid we have an external and the internal carotid. The branches of the internal carotid are most important because we have the very important branch which is the ophthalmic. Then the next important branch is the anterior cerebral, and the third important branch is the middle cerebral. So then we have the branches of the ophthalmic, which are the ending branches, that is the supraorbital, the supratrochlear, you have the lacrimal, you have the zygomaticofacial, and along with it you have the superior palpebral and the inferior palpebral. When we come to the branches of the external carotid, we have the occipital, we have the posterior auricular, the superficial temporal, and the facial. The facial artery is very important. You should know where the artery lies. Only a good knowledge about the anatomy will help you how to do a very safe filling procedure. So we have this facial artery which enters the face, piercing the cervical fascia just anterior to your maxilla, and then we have to have a good understanding about the nerves. So when I tell about the 7 commandments, the first 3 all relates to the anatomy, but the 4th is the magnificent 7 facial features which all of us should know. And when we look to all the 7 features, the facial shape, the forehead, the eyebrow shape, the nose and the lips, this can all be contoured with a filler. However, the eye size, the inter-eye distance and the skin clarity is beyond the domain of the injection. So the most important thing we should know, the 5th commandment, is how do we do a facial assessment. And the single feature is the symmetry. But I don't think the symmetry is absolute, where the right and the left side of the face we should consider as siblings, but for the lips and for the nose it should be always the twins. So when the novice artists start, they feel that the best way to know the symmetry is to divide the face into vertical fifth. But when you go ahead with your practice, what we all believe is the golden ratio, which is known as the divine proportion. This is the ratio where the adjacent part of the face is the same as the ratio of the sum to the larger quantities. If we look to all these beautiful ladies throughout the world, you will see that the ratio of this plus this is the ratio of this to the sum of the both the parts. So this is what we call the divine ratio. And what we know, because as we grow old, the triangle of a face gets inverted. The V-shaped triangle gets inverted to a reverse direction. And today what we believe is that the main 3D topography of the face changes with age because of the 4 Ds, that's the deflation, descent, deterioration and the disproportion. So the sixth knowledge is what is the paradigm shift. The shift today is from two-dimensional approach to a three-dimensional approach. The two-dimensional can be done with the neuromodulators and 3 with the hyaluronic acid fillers. And this is what we do, the two-dimensional approach, that is for the treatment of the crow's feet. What I always insist, the most important is the anatomy. You should know where this orbicularis inserts, and this is well within the rim. And once you know the anatomy, you are not going to make any blunder. So I just have 1 minute, I'll really go very fast. I just want to, because Botox I think most of you know, but what is the three-dimensional approach? Today the whole technology has undergone a revolution from the hyaluronic to a Vicross technology. Today what we have all the fillers with very low concentration of the hyaluronic acid, so there is a good tissue penetration. So when we do a filler, if you look to the red points, these are the points which should be avoided because you have the major vessels here. And when you do the eyebrow shaping, it is not necessary that you have to go for the 3-point injection. Even a single point injection gives a very good lift. But the tear trap, you can see I have marked all with red, because in the tear trap, the first point T1, where you have the infraorbital vessels, the T2 you have the angular, and the T3 is the zygomatic facial. So one should be very careful while doing a tear trough, and for the face lift we basically have the 5-point lift, and this is what we call a face lift with a 3D contouring. I think this presentation is too long. Should I stop it here, sir? So this is how we go ahead.
We'll have to hand over at 9 o'clock the next session starts.
So with this I end my presentation. I'm sorry I could cover only the 5 points, but thank you all very much for the patient.